Okay, so right now we will be looking at the disease named as multiple sclerosis, and it is a neurodegenerative disease in which degeneration of neurons occurs. That's why we call it neurodegenerative disease. It affects most commonly brain and spinal cord. So what happens, demyelination occur in this disease means brain and spinal cord nerves are demyelinated or loss of myelin sheath around nerves occurs. It is progressive disease means occurs at a time and then progress at multiple intervals of the time. The age of occurrence is between 20 to 40 years of age, and there are four types of multiple sclerosis. So if you look at the distribution on the basis of gender, women are more prone to develop as compared to men, and Caucasian female are more prone to develop this disease. Environmental effects can cause this disease. Viruses can cause, and genetic factor can be the causative agent of this disease. In this disease, brain lesions occur and then demyelination of the nerve occurs. Now let's suppose this is a neuron, and this neuron is surrounded by myelin sheath. In this disease, this myelin sheath is lost. That's why we call it demyelination disease. So in this way, multiple sclerosis occurs. So what are the symptoms? Visual impairment occurs because optic nerve is impaired. Tingling occurs. Memory loss can be there. Depression will be there. Urinary and bowel problems will be complained by the patient. So these are the signs and symptoms. How will we diagnose this disease? We will perform lumbar puncture, we will do MRI. In MRI and lumbar puncture, we will look at the CSF analysis, and oligoclonal antibodies will be there in CSF test. So in this way, we can diagnose this disease by these oligoclonal bands. So in the end, how can we treat this disease? For treatment, we will have to perform medication treatment, and chemotherapy can also treat this disease. So in this way, we can treat multiple sclerosis, which is demyelination disease, in which loss of myelin sheath occurs from brain and spinal cord, and that's why patient feels visual impairment and the tingling of the hands and feet, and then patient will also complain of weakness of the limbs and nerves. So in this way, multiple sclerosis patient presents.